What attracted you to a career in nursing home care?
What attracted me to a career in nursing home care is the unique opportunity it offers to build meaningful, long-term relationships with patients. I have always been drawn to professions that allow me to make a direct impact on people's lives, and nursing, particularly in a home care setting, embodies this in a deeply personal way. The ability to care for individuals over extended periods means that I can follow their progress, not just medically but holistically, ensuring their physical, emotional, and social well-being is supported. In a nursing home environment, you often work with elderly patients or those with chronic conditions who need consistent care. I find this both challenging and rewarding because it allows me to focus on not only managing their health but also improving their quality of life. Additionally, I was attracted by the collaborative nature of nursing home care, which often involves working closely with families and other healthcare professionals to create personalized care plans. This teamwork is crucial to delivering comprehensive care, and I thrive in environments where communication and collaboration are key. What stands out to me most, however, is the compassion that is central to nursing home care. Many of the patients we serve are in vulnerable stages of their lives, and being able to provide them with dignity, comfort, and respect is an honor. Nursing home care allows me to connect with patients on a human level, which is what I find most fulfilling about this career.
How do you approach providing care to elderly residents with complex medical needs?
When providing care to elderly residents with complex medical needs, I take a holistic, patient-centered approach that emphasizes compassion, communication, and clinical precision. Each resident has unique physical, emotional, and psychological needs, and I believe it's essential to treat them as individuals, rather than focusing solely on their medical conditions. The first step in my approach is conducting a thorough assessment of the resident's health status, medical history, and current care needs. This helps me understand the intricacies of their medical conditions and how they interact, allowing me to prioritize care and anticipate potential complications. I collaborate closely with doctors, specialists, and other members of the healthcare team to create a comprehensive care plan that addresses the resident's immediate health concerns while also planning for long-term management. Medication management is often a critical aspect of caring for elderly residents with complex needs, and I am meticulous in ensuring that medications are administered correctly and that potential interactions are carefully monitored. I also prioritize regular monitoring of vital signs and other health indicators to detect any changes early and respond quickly to prevent further complications. Equally important is maintaining clear, ongoing communication with the resident and their family members. I make it a point to listen carefully to their concerns, explain medical decisions in an understandable way, and involve them in the care planning process. This helps foster trust and ensures that the care provided aligns with the resident's wishes and personal values. In addition to managing the medical aspects, I focus on the resident's overall well-being. Elderly individuals with complex medical needs are often vulnerable to feelings of isolation or anxiety, so I make an effort to engage with them on a personal level. Providing emotional support, encouraging social interactions, and promoting activities that enhance their quality of life are key components of my approach. Ultimately, my goal is to provide high-quality, compassionate care that addresses both the medical and personal needs of the elderly residents, helping them maintain the highest possible level of comfort and dignity.
What experience do you have in managing chronic diseases common among the elderly population?
I have extensive experience in managing chronic diseases common among the elderly, such as diabetes, hypertension, arthritis, COPD, and dementia. Over the years, I've developed a deep understanding of how these conditions impact not just the physical health of elderly patients but also their overall quality of life. My approach to managing chronic diseases emphasizes a combination of medical management, patient education, and lifestyle modifications to improve outcomes and enhance the day-to-day well-being of residents. In my previous roles, I have routinely cared for patients with diabetes, for example, where managing blood sugar levels through medication, diet, and monitoring was a daily priority. I am well versed in insulin administration, wound care for diabetic ulcers, and educating patients on proper nutrition and lifestyle choices to better control their condition. Similarly, in dealing with hypertension, I ensure that medications are taken as prescribed while regularly monitoring blood pressure and making necessary adjustments based on the patient's response to treatment. Caring for residents with arthritis and other mobility-reducing conditions has also taught me the importance of pain management and physical therapy. I work closely with physical therapists to promote exercises that improve mobility while minimizing discomfort. I also pay close attention to the psychological impact these chronic conditions can have, often involving strategies to reduce feelings of frustration or depression related to reduced physical abilities. In the case of respiratory diseases like COPD, I have substantial experience in managing oxygen therapy, monitoring for signs of respiratory distress, and providing breathing exercises that can help alleviate symptoms. I've also worked with patients who have dementia, and I am familiar with the complexities of managing cognitive decline while ensuring that these individuals receive compassionate, patient care. This requires a great deal of empathy, communication with family members, and often adapting care strategies as the disease progresses. Across all these conditions, education is a central part of my role. I consistently provide residents and their families with information on managing chronic diseases, including medication adherence, recognizing warning signs, and understanding when to seek medical help. My goal is not just to manage the disease but to empower residents to take an active role in their care whenever possible, helping them live as independently and comfortably as they can, despite their chronic conditions.
How do you handle challenging situations, such as dealing with aggressive or agitated residents?
Handling challenging situations, such as dealing with aggressive or agitated residents, requires a calm, empathetic, and patient approach. In my experience, the key is to first understand the underlying cause of the behavior, whether it stems from pain, confusion, fear, or an underlying medical condition like dementia. Recognizing these triggers is crucial because it allows me to respond appropriately rather than react impulsively. When faced with an aggressive or agitated resident, my first step is to remain calm and composed. I understand that displaying frustration or anger can escalate the situation, so I focus on maintaining a soft, reassuring tone of voice and non-threatening body language. This helps to de-escalate tension and communicate to the resident that I am there to help, not to control or overpower them. Assessing the environment is another critical factor. Sometimes, agitation can be caused by overstimulation or discomfort in the resident's surroundings. I try to identify and remove potential stressors, whether it's noise, crowds, or discomfort, so that the resident feels more at ease. If the situation allows, I also encourage deep breathing exercises or gentle redirection to distract them from their agitation. Empathy is central to my approach. I try to put myself in the residents' shoes and listen to their concerns, even if they are expressed through anger or frustration. Sometimes, just validating their feelings by acknowledging their discomfort can help soothe their agitation. If the resident has dementia or cognitive impairment, I understand that they might be unable to communicate effectively, and I adjust my approach accordingly, using simple words or comforting gestures to ease their distress. At the same time, I always prioritize safety, for the resident, myself, and others. If the situation poses a risk, I ensure that proper protocols are followed, such as calling for assistance or removing any objects that could lead to harm. Collaboration with the healthcare team is essential in such cases, especially if the behavior is linked to medical issues or medication side effects, which may need to be addressed. After the immediate situation is resolved, I reflect on the incident to identify patterns or triggers and work with other staff and family members to develop strategies for preventing future episodes. This might include adjusting medication, creating a more structured daily routine, or developing personalized care plans that anticipate the resident's needs more effectively. In summary, my approach to handling aggressive or agitated residents is based on empathy, patience, and safety. By focusing on de-escalation and understanding the root cause of their behavior, I aim to provide care that preserves their dignity while addressing their immediate needs.
What is your experience with developing and implementing individualized care plans for residents?
I have significant experience in developing and implementing individualized care plans for residents, which I believe is a cornerstone of providing high-quality, patient-centered care. Each resident has unique medical needs, preferences, and personal circumstances, and a well-designed care plan helps ensure that all aspects of their health and well-being are addressed in a comprehensive and cohesive manner. My process begins with a thorough assessment of the resident, which includes reviewing their medical history, current health conditions, cognitive and physical abilities, and any social or emotional factors that may influence their care. This initial evaluation allows me to identify not only their medical needs but also their personal goals, such as maintaining independence, staying socially engaged, or managing chronic conditions with dignity. I also take into account their family's input, which is often crucial for tailoring the plan to the resident's lifestyle and preferences. Once the assessment is complete, I collaborate with a multidisciplinary team, including doctors, therapists, social workers, and dietitians, to create a personalized care plan. The care plan addresses all relevant aspects of the resident's care, from medication management and physical therapy to nutritional needs and social activities. I ensure that the plan is both realistic and adaptable, setting short-term goals that are achievable while still aligning with long-term health objectives. Regular monitoring and documentation are key to this process, as they allow me to track progress and make adjustments as necessary. Implementing the care plan is where my organizational skills and attention to detail come into play. I make sure that every part of the care plan is executed consistently, whether it's administering medications on schedule, coordinating therapy sessions, or providing daily assistance with personal care. I also take the time to communicate the plan clearly to other caregivers involved, ensuring that everyone understands their roles and responsibilities. Just as important as developing the plan is continually reassessing it. Residents' needs can change over time, especially in a nursing home setting, where health conditions may evolve. I regularly evaluate the effectiveness of the care plan and hold team meetings to discuss any necessary modifications. This might involve adjusting medications, introducing new therapies, or addressing emerging concerns such as mobility issues or cognitive decline. The goal is to keep the care plan flexible and responsive to the residents' changing needs, ensuring that their care remains relevant and effective. In addition to the clinical aspects, I focus on the resident's quality of life. For example, if a resident has dementia, I ensure that the care plan includes activities that promote cognitive engagement and emotional well-being, such as music therapy or structured social interactions. If a resident has limited mobility, the plan may include exercises or strategies to prevent further decline, while also promoting their independence as much as possible. Overall, my experience in developing and implementing individualized care plans has taught me the importance of personalization, teamwork, and regular evaluation. By creating a plan that integrates medical, emotional, and social factors, I aim to provide holistic care that enhances both the health and the well-being of the resident.
How do you ensure patient safety and prevent falls in a nursing home environment?
Ensuring patient safety and preventing falls in a nursing home environment requires a proactive, comprehensive approach that addresses both the physical and environmental factors contributing to fall risks. Given that elderly residents are often at higher risk due to age-related conditions like reduced mobility, poor vision, and balance issues, I prioritize a combination of individualized care, environmental modifications, and staff training to minimize fall hazards. The first step in preventing falls is conducting a thorough risk assessment for each resident upon admission and continuously updating it as their health status changes. This assessment includes evaluating factors like their mobility, strength, balance, cognitive function, and the medications they are on, as certain medications can cause dizziness or impair coordination. By identifying residents at higher risk, I can tailor their care plan accordingly, which might involve more frequent supervision, assistive devices like walkers, or physical therapy to improve strength and balance. A critical aspect of fall prevention is ensuring that the environment is as safe as possible. I regularly inspect the resident's living space to identify and eliminate potential hazards, such as loose rugs, clutter, or poor lighting. In high-risk areas like bathrooms, I ensure that there are handrails, non-slip mats, and accessible call buttons to reduce the likelihood of slips. Bed height adjustments and ensuring that essential items are within easy reach can also help prevent residents from overextending or straining themselves. Education and training for both staff and residents are also key components of fall prevention. I work with other staff members to ensure that they are trained to use proper lifting and transfer techniques, especially when assisting residents who have limited mobility. Regular in-service trainings help the team stay updated on best practices for fall prevention and how to respond quickly and appropriately if a fall does occur. Additionally, I educate residents about the importance of asking for help when needed, especially when moving or standing up after sitting or lying down for extended periods. For residents at particularly high risk of falling, I incorporate assistive devices such as walking aids, wheelchairs, or bed alarms that notify staff if the resident is attempting to get up unassisted. I also collaborate with physical and occupational therapists to develop personalized exercise programs that can improve residents' balance, flexibility, and strength over time, which is crucial in maintaining their independence while reducing their risk of falls. Monitoring medications is another critical aspect. I work closely with the medical team to regularly review each resident's medications to identify any that might contribute to dizziness, fatigue, or balance problems. If such risks are identified, I advocate for adjustments or alternatives to minimize these side effects. Communication is key to ensuring ongoing safety. I maintain open lines of communication with the residents, their families, and the rest of the care team to ensure that any concerns or changes in the residents' mobility or health are quickly addressed. I also document all fall-related incidents, no matter how minor, to analyze patterns and make any necessary changes to the care plan or environment. In summary, my approach to ensuring patient safety and preventing falls involves continuous assessment, personalized care planning, environmental safety measures, staff education, and proactive resident support. By staying vigilant and responsive to both individual and environmental factors, I aim to create a safer and more secure living space for all residents.
What is your experience with providing end-of-life care and supporting families during difficult times?
I have extensive experience providing end-of-life care, and it is one of the most sensitive and profound aspects of my nursing career. End-of-life care requires not only clinical expertise but also deep empathy, compassion, and a strong understanding of the emotional and psychological challenges faced by both patients and their families. My goal in these situations is to ensure that the patient's final days are as comfortable and peaceful as possible, while also supporting their family members during what is often an incredibly difficult time. In terms of clinical care, my focus is on managing symptoms and providing comfort to the patient. I prioritize pain management, often working closely with the medical team to adjust medications and treatments that alleviate discomfort, whether it be physical pain, shortness of breath, or anxiety. This may involve palliative care methods, such as administering appropriate pain relief or assisting with non-pharmacological interventions like repositioning, breathing exercises, or soothing touch to provide relief. I make sure to monitor the patient's condition closely, adjusting care as necessary to ensure their comfort is maintained. Equally important is the emotional and psychological support I provide. Patients at the end of life often experience feelings of fear, uncertainty, and emotional distress, and it's essential to listen and respond with patience and understanding. I take time to sit with the patient, talk to them, and provide reassurance, even if they are nonverbal, as I believe human connection plays a vital role in their comfort and dignity during their final days. I also respect their wishes, preferences, and values regarding how they wish to be cared for, which often includes respecting cultural or religious practices related to death and dying. Supporting the family during this time is another crucial part of my role. Families are often overwhelmed by grief, stress, and uncertainty, and they look to nurses for guidance and emotional support. I provide clear, compassionate communication to help them understand the stages of the dying process, what they can expect, and how they can participate in their loved one's care if they choose to. By answering their questions honestly, providing updates, and explaining medical decisions in simple terms, I aim to alleviate some of their fears. I also make it a priority to offer emotional support, whether it's through listening, offering a comforting presence, or providing them with resources like grief counseling or support groups. In these moments, I recognize that everyone experiences loss and grief differently. Some families may want to be closely involved in their loved one's care, while others may need space to process their emotions. I respect these boundaries and tailor my approach based on the individual needs of the family, always ensuring they know they have support if they need it. After the patient has passed, I continue to offer compassionate care to the family. This includes helping them navigate the practical aspects of end-of-life care, such as connecting them with bereavement services, as well as offering a kind word or a quiet presence in their time of sorrow. I strive to honor the memory of the patient and acknowledge the family's grief, as I understand that the process of saying goodbye extends beyond the moment of death. In summary, my experience with end-of-life care has taught me the importance of balancing clinical care with emotional support. By focusing on symptom management, providing a peaceful environment, and supporting families through transparent communication and compassion, I aim to make this challenging time as comfortable and dignified as possible for everyone involved.
How do you maintain effective communication with residents, their families, and other healthcare professionals?
Maintaining effective communication with residents, their families, and other healthcare professionals is essential to providing high-quality, coordinated care. In my experience, clear, compassionate, and timely communication fosters trust, reduces misunderstandings, and ensures that all parties are aligned in their approach to the residents' health and well-being. With residents, I prioritize active listening and empathy. Many residents, especially the elderly, may struggle to articulate their needs due to cognitive decline, hearing impairments, or emotional distress. I take the time to engage with them on their level, speaking slowly and clearly, and ensuring they feel heard. I also use nonverbal communication cues, such as maintaining eye contact, a reassuring tone, and gentle body language, to convey understanding and support. Additionally, I tailor my communication style to each resident's cognitive and physical abilities. For example, with residents suffering from dementia, I use short, simple sentences, and I offer clear choices to avoid overwhelming them. When communicating with families, I recognize that they are often under stress and may have a range of emotions, from worry to frustration. I make it a point to keep family members informed about the resident's condition, treatment plans, and any changes in their health. I do this through regular updates, either in person, over the phone, or via written communication, depending on the family's preferences. Transparency is key. I explain medical terms in simple language and ensure that they fully understand the resident's care plan. I encourage family members to ask questions and express their concerns, and I always respond with empathy and patience, as I understand that their input is vital to the residents' overall care. I also believe that involving families in the decision-making process, when appropriate, helps build trust and ensures that care aligns with the residents' values and preferences. For example, in end-of-life situations or when making difficult medical decisions, I provide families with all the information they need to make informed choices, offering support without imposing my opinions. Communication with other healthcare professionals is equally important for providing coordinated care. I maintain a collaborative approach, ensuring that all members of the care team are updated on the resident's condition, care plan, and any changes. I document everything meticulously in the resident's medical records, so other professionals have accurate, up-to-date information when making decisions. Regular team meetings, whether formal or informal, are essential for discussing the resident's progress and any necessary adjustments to the care plan. I also ensure that I clearly relay any concerns or observations to the physicians, therapists, or other specialists involved, advocating for the resident when needed. In situations where urgent communication is required, such as a sudden change in a resident's condition, I ensure that information is conveyed promptly and accurately to both the healthcare team and the family. This includes providing all relevant details to the medical team and, when speaking with the family, explaining the situation in a way that balances urgency with reassurance, so they feel informed but not unnecessarily alarmed. In summary, effective communication requires adaptability, clarity, and empathy. By maintaining open, honest, and respectful communication with residents, families, and other healthcare professionals, I ensure that care is well coordinated, patient-centered, and responsive to the needs and concerns of everyone involved.
What are your thoughts on the importance of providing emotional and social support to nursing home residents?
Providing emotional and social support to nursing home residents is just as important as addressing their physical and medical needs. Many residents in nursing homes, particularly the elderly, face feelings of isolation, loneliness, anxiety, and depression due to a range of factors such as being separated from their families, losing their independence, or dealing with chronic health conditions. As a nurse, I believe that holistic care encompasses not only physical health but also emotional and social well-being, and supporting these aspects can significantly enhance the overall quality of life for residents. Emotionally, many residents experience fear, frustration, or sadness, especially as they adapt to life in a nursing home. By providing a compassionate, empathetic presence, I can help ease some of these emotional burdens. Taking the time to listen, acknowledging their feelings, and offering reassurance helps residents feel valued and understood. Small acts of kindness, such as offering a smile, engaging in a meaningful conversation, or simply sitting with a resident during difficult moments, can have a profound impact on their emotional health. I have found that when residents feel emotionally supported, they are more likely to be engaged in their own care and show better overall well-being. Social support is equally critical. Many residents struggle with the loss of social connections, particularly if they are no longer able to interact regularly with family or friends. Encouraging social interaction within the nursing home can counteract this isolation. I actively promote group activities, such as communal meals, games, or social events, which can foster a sense of community and belonging among residents. I also try to facilitate individual connections, whether it's introducing residents to each other based on shared interests or helping them maintain relationships with family and friends through phone calls, video chats, or visits. Additionally, I recognize that some residents may require more encouragement to participate socially, especially if they are introverted or dealing with physical or cognitive impairments. In these cases, I use a gentle approach, offering one-on-one activities or finding quieter social opportunities that suit their preferences, ensuring that they are not excluded from social engagement. The benefits of providing emotional and social support go beyond immediate comfort. Studies have shown that social interaction can help prevent cognitive decline, improve mood, and even boost physical health outcomes in the elderly. When residents are emotionally and socially supported, they are more likely to feel a sense of purpose, maintain independence for longer, and experience fewer mental health issues such as depression and anxiety. From my perspective, integrating emotional and social support into daily care routines is essential for creating a nurturing, person-centered environment. By addressing not only the medical but also the emotional and social needs of nursing home residents, we can help them live with dignity, maintain their identity, and experience a higher quality of life, regardless of their physical limitations.
How do you approach building relationships with residents and their families?
Building relationships with residents and their families is a fundamental aspect of nursing that greatly impacts the quality of care we provide. I approach this by first establishing a foundation of trust and open communication. From the moment I meet a resident, I strive to create a welcoming environment where they feel comfortable expressing their needs and concerns. I take the time to listen actively, demonstrating empathy and understanding, which helps to alleviate any anxiety they may have. Understanding that each resident is unique, I make it a point to learn about their individual backgrounds, preferences, and life stories. This not only helps me to provide personalized care but also shows residents and their families that I genuinely value them as individuals. I also encourage family involvement in the care process, as their insights can be invaluable in understanding the residents' needs and preferences. I keep them informed about their loved one's condition and care plan, ensuring they feel supported and included in decision-making. Moreover, I believe in the importance of regular follow-up and maintaining communication. By being available to address any questions or concerns that arise, I reinforce that I am an advocate for both the residents and their families. Overall, my approach centers on building meaningful, respectful relationships that contribute to a nurturing care environment, ultimately enhancing the well-being and satisfaction of the residents and their families.